In this podcast episode, Robert F. Kennedy Jr., the Secretary for Health and Human Services in the U.S. government, joins Theo to discuss a wide range of critical issues affecting public health, the environment, and government transparency. Topics include recovery and personal resilience, environmental and food safety policies, pesticide litigation, government reforms, healthcare transparency, addiction treatment, the integrity of scientific research, and political polarization. The episode opens with Kennedy reflecting on his decades-long journey in recovery, emphasizing the importance of daily meetings and mutual support among individuals battling addiction. He shares how the continuity of in-person meetings, even during challenging times such as the COVID-19 pandemic, helped sustain his sobriety and offered survival benefits. Friendships formed through recovery circles play a crucial role in maintaining hope and accountability. This foundation allows for a candid conversation emphasizing personal responsibility intertwined with systemic reforms needed to address addiction effectively. Kennedy discusses various progressive policies in Tennessee aimed at protecting public health, such as the state's approach to banning harmful food dyes and regulating sugar, corn syrup, and fluoride in drinking water. He highlights Tennessee's pioneering SNAP waiver program that restricts food stamp purchases of unhealthy products like sodas and candy. The Tennessee Fluoride-Free Water Act is presented as a significant development, responding to studies linking fluoride exposure to reduced IQ and other health issues, emphasizing the state's choice to avoid adding fluoride compounds to public water. Kennedy praises Governor Bill Lee's bipartisan efforts and legislative progress on these fronts. A significant portion of the conversation centers on the contentious Tennessee Farm Bill 809, which sought to limit liability for pesticide-related illnesses if the products had EPA-approved labels. Kennedy exposes how this legislation threatens the rights of farmers and consumers to seek justice against companies like Monsanto, whose practices obscured dangers associated with herbicides such as glyphosate. He details his legal battles against Monsanto, resulting in billion-dollar verdicts for victims suffering from non-Hodgkin's lymphoma, and illustrates Monsanto's collusion with corrupt EPA officials who manipulated or ghostwrote scientific studies to downplay health risks. These revelations underscore the aggressive corporate interference in public health safeguards. Kennedy discusses the challenges facing American farmers, who rely heavily on toxic pesticides but face risks including health problems and soil degradation. He points to innovative solutions like laser technology for weed and pest control as promising alternatives to chemical dependency, though current costs remain prohibitive for widespread adoption. This highlights the complex balance between public health concerns and the economic realities of agricultural production. As Secretary of HHS, Kennedy describes efforts to increase government transparency and efficiency. His department is leveraging artificial intelligence to drastically improve access to public records, speeding up freedom of information requests that once took months or years. He explains recent workforce reductions in HHS aimed at cutting bureaucratic redundancies and refocusing research priorities towards investigating causes of chronic diseases and replicating scientific studies, issues traditionally neglected. Kennedy underscores the systemic problems of scientific misconduct incentivized by unreproducible research and biased publication practices. The episode digs deep into the corruption permeating scientific publishing, with major medical journals functioning as propaganda outlets for pharmaceutical companies. Kennedy stresses the necessity of open-source journals and transparent peer review processes to restore credibility and depoliticize science. He describes the prevalence of hired expert scientists used to sway public and regulatory opinion, complicating public trust in health guidance. Using the example of decades-long Alzheimer's research based on flawed amyloid hypotheses, he illustrates how embedded interests and lack of replication can hinder progress. Kennedy reveals striking instances of widespread Medicare and Medicaid fraud, including fake nursing agencies and inflated billing schemes in vulnerable communities, some even funding terrorism abroad. Historically, government agencies operated on a pay-and-chase model that allowed fraudsters to collect payments up front with limited recovery efforts. Under current reforms, AI-powered systems help identify fraudulent claims before payments are made, promising to save tens of billions annually. While Medicare fraud is easier to control federally, Medicaid fraud control requires state cooperation, with certain states resistant to change. The conversation shifts to the broader healthcare landscape, where Kennedy identifies the U.S. as the sickest developed nation, plagued by chronic diseases, obesity, and poor health outcomes despite high spending. He points to diet as a major factor, criticizing past government dietary guidelines heavily influenced by industry interests. Kennedy highlights efforts to overhaul the food pyramid grounded in rigorous scientific review and push for better nutrition education among medical professionals. Transparency strides, such as eliminating prior authorization delays and requiring hospitals to publish procedure prices, aim to empower patients as decision-makers in their care. These moves intend to shift healthcare from a profit-driven model reliant on sickness to one focused on genuine wellness. Kennedy emphasizes the enormous social and economic costs of addiction, advocating for integrated, lifelong care approaches as opposed to fragmented treatment. HHS is piloting programs uniting multiple agencies to oversee an individual's recovery journey comprehensively, covering medical, social, housing, and employment support. This model aims to disrupt the current system where service providers profit from repeat addiction cycles and lack accountability for outcomes. He underscores the need for cohesive interventions to reduce relapse and improve long-term recovery rates. Kennedy discusses the deep polarization that hinders bipartisan cooperation in Washington, contrasting today's tribal politics with the more collaborative era when his uncle, President John F. Kennedy, legislated across party lines. He names several congresspeople and senators across the aisle whom he respects for their independent stances on health and policy issues, but laments the rigid political environment that stifles genuine discourse, especially for those associated with former President Trump. He urges a return to principled, conscience-driven politics for the nation's benefit. When asked, Kennedy touches on the ongoing release of JFK assassination records ordered by President Trump. Although classified and sensitive information has been declassified, no definitive new revelations implicating specific actors have emerged. Personal family connections, including his daughter-in-law heading an intelligence agency responsible for the releases, provide him with unique insight. Yet many files remain redacted to protect other individuals. Closing, Kennedy advises listeners to prioritize real, unprocessed food, reinforcing that nutrition is medicine. He stresses that healing and health maintenance are accessible through lifestyle changes, urging everyone to avoid packaged, industrialized products laden with chemicals. He reaffirms his commitment to public service and encourages individuals to take ownership of their health through informed choices and advocacy.